So I will explain to you what risk factors are for epi and pandemics, and also what zoonotic diseases are, and we will just briefly discuss antimicrobial resistance. Thanks for the introduction, and thank you all so much for coming. And also thanks for the opportunity to speak here about human health and animal agriculture and how pandemics and other health crises are basically reinforced by animal agriculture. Yeah, I was already introduced, but I'm Luisa, and as we heard before, I've been an animal rights activist since 2020 and mainly active for PETA. And regarding academics, I did my bachelor's in public health and then continued with my master's in epidemiology. So for today's agenda, we will first just quickly start with health and epidemiology, what both of these concepts are and how they are connected to animal rights, and then dive deeper into infectious diseases and what the risk factors for epi and pandemics are. And also in the end of this chapter, we will quickly touch on zoonotic diseases and antimicrobial resistance. And then before we conclude, we will have a look at the past, present, and future of diseases by discussing the epidemiological transitions and how animal agriculture might have impacted these. And then lastly, of course, we will conclude with some key takeaways and what we can and should do about the topics that we discussed. So I will, in between each part, I will give a quick summary because I think it's going to be a lot of information, and I think some repetition is helpful in order to take the most out of this presentation. And also in the end, I will provide you with a document with a summary of this presentation and also some further details and all the resources that I used. And in case you want to do some research yourself, you can also do that because I included some further resources. So yeah, let's start. So when we discuss health and when we want to talk about health, we first need to be clear about what health actually is. And if I asked each one of you to explain to me what health is for you and what it looks like, we will probably get a lot of different answers. Because actually health, health is not as objective as we think it is. And the WHO formulated this definition in 1946, which is that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And moreover, the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic or social condition. So this definition is quite broad and has also been criticized for being really focused on the individual person and being really human-centric, which is interesting for us as animal rights activists. And as I said before, there are different perspectives on health, and because of that, maybe I should use this. Because of this, there have other concepts and frameworks been developed, two of which are the One Health approach and the global health model. I give some details in the document, in the summary document, but for now I would like to move on to the planetary health model, which is a solutions-oriented transdisciplinary field and social movement focused on analyzing and addressing the impacts of human disruptions on to Earth, natural systems, on human health and all life on Earth. So when we compare this definition with the definition that we heard before, three things stand out. So firstly, the transdisciplinarity, which takes into consideration that not only the medical profession is involved in creating and sustaining health, but also other definitions. And then we have the second and thirdly, that this model acknowledges the damage done by human behavior and its impact. This is the third aspect on the health of the planet, the ecosystem, non-human animals, and human beings. So this model is actually the most comprehensive model of all that I mentioned today, because it includes all forms of life and all forms of health. And in global crises like climate change, for example, and also pandemics, this model gains more and more importance. And when we want to create health in a sustainable way, I believe that we need to rethink health in a way that includes all living beings, because that's actually the way to go, in my opinion. Now that we covered health, we move on to epidemiology, which is one of the 5 core disciplines of public health, and it studies the occurrence and distribution of health outcomes or diseases within populations, and also the determinants and factors that influence health outcomes and diseases, and then lastly, how this knowledge can be applied in order to prevent and control health problems. So an example would be that you might recall quite easily is the COVID-19 pandemic. So what epidemiologists did during that time was not like they did not look at the virus itself and how the virus looks like, but they would ask questions like how does the virus act in a given population or in different populations? How does it spread? Which factors increase or decrease the likelihood of getting infected or to experience a severe infection? And also, of course, what can be done to control the disease and to prevent people from dying or getting severely infected by the disease. There are a lot of sub-disciplines of epidemiology. These are just some examples, but we will today focus on infectious diseases. So why is this important for us to know? We really face urgent and dangerous health threats in regards to climate change and infectious diseases and pandemic risks, which are at least reinforced by animal agriculture, if not more than that. And also in a room full of animal rights activists, I know that some of you reach out to different stakeholders and different people with some, maybe even some power, and I think it's great to have some information to use if you reach out to these stakeholders to address the issue. And also, especially during the last couple of years, there has been a lot of wrong and false information being put out online, especially about diseases and pandemics. And I think if we want to be reliable and taken seriously as a movement, we need to make sure that we do not spread wrong information. And however, that being said, I do not want to give the impression that I put human health above animal health and above animal rights. It is, of course, equally important. And the core message of veganism is equality of non-human animals and humans. And just as a disclaimer, I will be talking a lot about human health now, but I have not forgotten about what veganism is about. So to summarize the first part, so we know now that there exist different frameworks of health, and for a holistic approach of health, we need to take non-human animal, and environmental health into account, as it is strongly connected to human health. And epidemiology studies the occurrence, distribution of, and influencing factors on diseases in order to prevent and control diseases. And human health can be a powerful argument when we want to advocate for animal rights. So as I mentioned, we will focus on infectious diseases now, or today, during this talk. So I will explain to you what risk factors are for epi and pandemics, and also what zoonotic diseases are, and we will just briefly discuss antimicrobial resistance. And just as a side note, in case you have not heard it before, an epidemic refers to a disease outbreak which is limited to a region, so it can be a smaller region like a country, also, or a bigger region like a continent. And a pandemic would be a disease spread that is global, on global scale, like the COVID-19 pandemic. Just as a side note that you heard it somewhere. So when we look at infectious diseases and pandemics, they do not just appear out of nowhere. There have to be some conditions met in order to go from a single outbreak to a spread or even an epi or pandemic. And this is called the chain of infection. And these conditions that I mentioned can be divided into groups, conditions of the pathogen, the host, and the environment. Don't worry, we will not talk about all of these. I will just explain the concept of susceptibility and exposure, which are conditions of the host and the environment. So what is susceptibility? So this basically describes how likely an individual, which can be a human or non-human animal, will be infected by a pathogen, can be a virus, can be a bacterium, can be fungi, etc. And also just, again, as a side note, if we talk about non-infectious diseases, a pathogen could also be things like radiation, air pollution, noise even. So anything that makes us sick is a pathogen. And this likelihood of getting infected can be altered by different factors. For example, stress, the immune system, and general weakness. I think we all experienced that before. If we go through a period where we are stressed, or we haven't slept enough, or we haven't eaten well enough, we are more likely to get sick because we are more susceptible to catching diseases. And as you probably guessed, non-human animals that are raised within animal agriculture are highly susceptible to pathogens because they are under constant stress and just the overall conditions are really bad for them. Moving on to exposure. Exposure is basically, like it refers to the characteristics of the environment that make an infection more or less likely. So the environment that we live in pretty much like has a lot of influence on how likely we will catch a disease. And again, we see a lot of non-human animals on small areas and also a lack of hygiene, which make the exposure to pathogens more likely. And additionally to that, we also see factors that increase the risk for the development of a zoonotic disease, which I will explain in a minute. And these factors are, for example, close contact to humans and wildlife. So because we need so much space for the farmed animals, we invade wildlife spaces because, and what happens then is that the farmed animals are in contact with wild animals, and that increases the likelihood of a zoonotic disease. And also, before, during, and after slaughter, humans are also in contact with possibly infected body fluids, where a pathogen, a virus, whatever it is, can jump over to the human. So, talking about zoonotic diseases. Zoonotic diseases is an infectious disease that has jumped from a non-human animal to humans. And the way this can happen, this is just one example, is that when we have a wildlife population, for example, a population of wild birds, some virus emerges there or first originated in the birds. And as I said before, we invade the wildlife spaces of these birds, so the birds fly through the barns, for example, and then get in contact with any kind of farmed animal. And what happens then, like if the bird gets infected with a virus, this virus usually is pretty adapted to this bird organism and can only spread from bird to bird. But the more this virus gets in contact with another organism, for example, a pig's organism, the more the virus learns, and we have seen it during COVID, viruses mutate pretty quickly. So at one point, the more often this happens, at one point the virus has adapted to this new organism and now can actually spread from pig to pig. And then again, we as humans are in contact with this pig, no matter either with the living pig or over animal products. And then the more chances we give the virus to infect humans, the more chances we give it to adapt to a human organism. And then at one point we will see that the virus can spread from human to human. And then we, with the conditions we live in today, with climate change, growing population, also international travel, we will quickly run into a situation of a global pandemic. So you see here some examples of zoonotic diseases. This is again not a complete list, just some examples. I don't even know if you can read it. But yeah, we see COVID, of course, avian influenza, HIV, rabies even. Yeah, so there have been a lot of diseases that actually originated in animals. What I just explained, just as a disclaimer, what I just explained was of course pretty simplified, and there are other factors like that are involved into this process of a zoonotic disease. Yeah, just that you don't think that I just explained everything. Yeah, and then a second threat, or another health threat that we face is antimicrobial resistance. In case you're not familiar with this, it describes, or it refers to bacteria that do not respond to antibiotics because they became resistant due to over or improper use of antibiotics. And again, 50% of worldwide used antibiotics are used in animal agriculture, and we don't even know if that's the exact number because some countries do not report their antibiotic use sufficiently, and it's estimated that the actual number is up to 50% higher. And then these antibiotics also, like, we consume them via food and water, and then bacteria can adapt to these antibiotics and make them less effective or even useless for treatment. So yeah. And again, we are at the end of the second chapter. So to summarize, if and how infectious diseases spreads depend on certain conditions of the pathogen, the host, and the environment. The conditions that we find in animal farming practice make the animals highly susceptible to pathogens and the exposure really likely. Through human contact with non-human animals and their body fluids, the risk of the development of a zoonotic disease increases, and then also due to the use of antibiotics in animal farming, we face this is a major contributor to the emergence of antimicrobial resistance. Yeah. Now on to epidemiological transitions. So when we look at the history of humanhood and the history of how diseases infected us as humans, of course it is kind of like, if you think about it for a minute, it is clear that the people now are affected by disease differently than a couple of hundreds or even 1,000 years ago, just because of a variety of things that happen and conditions that we live in. And we can make, if we look at that, we can make up 3 so-called epidemiological transitions. So the first transition was the age of pestilence and famine, and it took place around 10,000 years ago, and it was characterized by a rise in nutritional and infectious diseases and has been linked to agriculture and food production. Secondly, we have the age of receding pandemics, when improved living conditions, hygiene, nutrition, etc. caused a shift from infectious diseases to chronic diseases as the major contributor to mortality and morbidity. And then lastly, the third transition is called the age of degenerative and man-made diseases, which basically describes that the majority of the diseases that we face these days are caused by human behavior, like unhealthy diets, lack of physical activity, pollution, etc. At the same time, though, we see a re-emerge of infectious diseases, leading to a so-called double burden of disease. I will not get into this too much now, but just that you heard it before. And we saw that, for example, with COVID-19. So this double burden of disease, or this re-emerge of infectious diseases, is reinforced by urbanization, population density, and globalization, and also the destruction of resilient ecosystems. So when we look at these transitions and when infectious diseases emerged or re-emerged, we see that at 2 points in time, the way we produce food and the way we use animals for food production changed. So firstly, in the first transition, that this was approximately when humans settled down and the number of animals that lived with close to humans increased. And then thirdly, of course, more or less right now, the demand for animal products is as high as never before, and it keeps rising. And yeah, so this is a connection that I drew, that infectious diseases actually re-emerge now because, or maybe because of the way we use animals. Just as a disclaimer, this model has also been criticized, and it is not perfect or complete. because it is really Western-centric and ignores social determinants of health. However, for the sake of this presentation, I choose this model because I think it underlines the points that I would like to make. And secondly, a second disclaimer, the link that I drew now from animal agriculture to infectious diseases is just a hypothesis, and we have actually not, like there's no causal relationship that we know for sure at this point at least. So, yeah. To summarize the third chapter, so due to the changing knowledge, living conditions, and achievements in healthcare, the burden of disease has been changing. And these changes might also be attributable to animal agriculture, namely the emerge and re-emerge of infectious diseases. And with that, we already reached the conclusion with the key takeaways. So the key takeaways are that we might see impacts of animal agriculture on human health and diseases in the epidemiological transitions. Animal agriculture is not only extremely cruel for non-human animals and detrimental to the planet, but also serves as a breeding ground for infectious diseases. The way we produce animal products combined with growing population and growing population density and international travel are best conditions for a pandemic to arise. And apart from infectious diseases, climate change possesses enormous health risks, which are again reinforced by animal agriculture. The last point is something that I did not get into with this presentation, but I didn't want to ignore climate change because I think it's pretty important. And yeah, so now, most importantly, what should we do now about this? So in healthcare or in health science, we distinguish between primary, secondary, and tertiary prevention. You can ignore this for now. I just put it up to be complete. So firstly, obviously, we need to stop using and abusing non-human animals. I think we can all, I don't have to explain why. But I think we can also see that it is pretty unlikely that we see a vegan world from now till tomorrow. We will not see this sudden change. So I think in regards at least to infectious diseases, a decrease of the amount of non-human animals living in small spaces and a decrease in the susceptibility of non-human animals would be a good start. Then we should not intrude into living spaces of wild non-human animals, again, because then we decrease the likelihood that a virus jumps over from a wild animal to a farmed animal. And then also going on to this progress, we will not see as many viruses jumping from a farmed animal to a human. We need to maintain resilient ecosystems, and because if an ecosystem is resilient, a virus has a harder time to actually spread in this ecosystem. And then touching on antimicrobial resistance, we need to monitor and decrease the use of antibiotics, which is luckily already in place and worked on. You can read about that in the summary document. And also talking about antibiotics, if you happen to get sick and you need antibiotics, it is really important that you take these antibiotics as your doctor prescribed and you do not end the treatment too soon, because then you give the bacteria a chance to adapt to these antibiotics and make them useless. So this is actually something that you can do. Moving on to secondary prevention, so we need strict hygienic regimens for contact with farmed non-human animals, and also awareness about how to handle animal products, especially raw animal products. So if you happen to live with people who consume animal products, it is really important that all the utensils and cutlery that you use for animal, not you, but someone uses for animal products are washed thoroughly, especially if you consume raw products. So if someone cooks and then, cuts meat, and you, a couple of hours later, cut your raw fruit on the same cutting board, it is really dangerous, because then if there was a virus or bacteria or whatever on this meat, you consume that and then you get infected. So, yeah. And also close monitoring of outbreaks. So if we witness outbreak, not we, but if people witness outbreaks, we need to act fast and monitor where certain viruses broke out. And then tertiary prevention, we need pandemic preparedness. So if we see a spread of a disease with pandemic potential, we need to act fast and we need to know what to do about it, what measures we have to take. And luckily, especially after COVID, this gained more and more attention and this is already in place and worked on. And yeah, you can read about that in the summary document. And with that, actually, we are at the end. Thank you a lot for listening. I hope you learned something. If you have any questions, I'm happy to answer them right now. You can also contact me via email. And here's a QR code as promised, which brings you to the summary document with all the links and information. Yeah, thank you.
Cool, we've got time for questions. We've got about 15 minutes, I think, so we've got a decent amount of time. To anyone else, so I know who I'm coming to after? Okay.
Thank you. Hello, and thank you very much. I've got a question. You're writing in the antibiotics that we were able to consume them via water. How is that possible?
Yeah, so as I said, farmed animals are fed antibiotics in pretty large amount of numbers, and we know that whatever, like when we fertilize fields, the animal poop and whatever is like put onto the fields and then rains, and then anything that is in the poop can come into the groundwater, and then if we drink the water, there might be traces of that in the water. I think there's a follow-up question.
He says, how do you know?
How do you know what, like that there's...
How do you know if the water's contaminated?
There's like water is controlled pretty well actually, and you can find actually like traces of the antibiotics. Like you can find anything in water, especially like during COVID. We could trace back where the outbreaks were when we looked at the water, because traces of the COVID virus were in the water. So if you test for that, you can find traces of antibiotics in the water. But I'm not an expert on antibiotics. That's just what but.
Thank you very much for your talk. It was very interesting, and it's a very important topic. And I wanted to ask if you have any expectation which could be the next pandemic, or which infectious disease could be evolved to a future pandemic, and the time when it will happen, more or less.
So the time, I cannot say anything about the time, but I don't know if you heard, but during COVID, everyone was saying like this will not be the last pandemic that we will like face. And actually, influenza is a pretty like the influenza virus mutates pretty quickly. That's why I don't know if you have ever got vaccinated against influenza, but each year there's a new influenza vaccine, because the influenza virus actually mutates pretty quickly. And I think it's speculated that the next pandemic, so to say, will probably be avian influenza. And actually during the last couple of months, there have been a lot of some jump overs from cows to humans of the avian influenza via consuming, via the consumption of milk products, especially raw milk. So if you know anyone who consumes raw milk, please tell them, apart from the animal rights aspect, that to not do that, because raw milk is really, I would never consume that.
Cool. Okay, cool. I've got a quick one, then I'll hand over. I wanted to ask, during COVID and the aftermath, it was kind of the connection with animals was mentioned, but often in the context of simply wet markets, rather than particularly factory farming being a massive, gaping hole, Do you think there was a particular reason for that? Do you think industries had an influence on the conversation? Do you think people just didn't want to because they didn't want to face the prospect of having their meat taken away from them? Do you think it was ignorance? Why, or do you just think there is no particular reason?
I think it's actually, I don't know if I would call it racism necessarily, but we like, I don't know, I heard here, like during that time I heard a lot about like, yeah, those people, they consume these kinds of meat and those people do this and that and whatever, and no one really acknowledged that we do that too. Like we also like, not we, but you know what I mean, like we consume animals. It's just, it's always us and them, like they do this and now they cause this, but no one wants to say that, yeah, but we do actually the same, it's just another species. The same with dog festivals, like dog meat festivals. Every year this happens, there are so many petitions and so many people who speak up about how horrible it is to consume dogs, but no one actually acknowledges that we, like that pigs, cows, whoever, like whatever species is also tortured and killed and consumed. So I think it kind of comes from that. So like this Western-centric perspective that everything that we do is correct and right, and everything they do is horrible and causes all of these things. Yeah.
Thank you so much for this presentation and for all that you're doing. And also just for touching on racism, I am from New York and we worked to close, during COVID, we tried to have the slaughterhouses shut down for obvious reasons. Because in New York and I think at least throughout the US, slaughterhouses are historically put in more low-income, marginalized areas where they already have limited access to healthcare and other basic resources, and are also have higher comorbidity and higher exposure to like light, air, water pollution. And so I'm curious, you have like 3 tiers of prevention, and I'm just curious if in any of those tiers you also consider aligning with either entities that regulate labor, for example, to protect the workers who are tracking all of the dirt that don't have proper PPE, for example. And also, are you working with any community-based groups that may not necessarily care about non-human animals, but that do care about systemic oppression, which is directly related? And so those are my 2 questions. Is in any of your prevention, your tiers of prevention, have you considered or done the work to connect with community-based and labor-based organizations?
Yeah, so what you touched on in your question is the aspect or the concept of health equity. So indeed, like people who are of lower socioeconomic status, people who might, like any kind of people, have less access to health and healthcare. And of course, yes, these are also, that's what you said, these are also the people that are threatened by health risks like that, firstly and before anyone else. And this would actually, like if you talk about these tiers of prevention, this would go into, I would say, secondary prevention, because like something like health at workplaces and safety at workplaces would be something that we need to work on in order to prevent the jump from the pig or cow, whatever is slaughtered, to the human. So that would go into secondary prevention. Does that answer your first question? Or kinda?
Partially, just because I was wondering if that was in one of the considerations, because I'm also looking at maintain resilient ecosystems.
Yes.
So I was thinking about that also. But then the other part of it is if any contact or connections have been made with labor forces or labor entities or community-centered organizations that are working to protect marginalized populations.
Okay. Not by me at least, I know that the WHO raises awareness about this. Health equity is a huge point. But yeah, I also see, like on a professional level, that there is a lot of awareness about this topic and how dangerous animal agriculture is and the way we handle meat products. And I read a lot of articles and studies on that. But I think what's really important is we have to inform the public, because also during COVID, no one, like I don't know how your experience was, but no one really talked about the origin of the virus, like where it actually came from and what conditions or what led to this pandemic, that it was not a one-time thing, that it's something that is really likely to happen again, and also happened in the past. So no, I do not, I have no contact to like community services and things like that. If that answers your question, okay, great.
Cool. Any more? Okay. While I'm walking over, I'll ask a quick another one. So vegans, like, it depends on the vegan, but often we can come into contact with animals as well through, like, you know, undercover work or working on sanctuaries, stuff like this. Are there like things vegans do or don't do that you look at and think like, why are you being such an idiot? You know, you're not taking proper health precautions, or you should not be doing that at all. Like, is that, because I volunteer on a sanctuary, and like, you know, sometimes, you know, give the animals belly rubs and stuff. Is there like stuff that we should all be aware of for our like personal work with animals?
I mean, like, washing your hands is always a good idea, but I think the dangerous situations are not in animal sanctuaries, because they are, as I said, the animals are less susceptible to viruses, and also the exposure is less likely. So I think you don't really have to worry about that too much when you work in animal sanctuaries. I think if you go into farms, then you have to be really beware of that. And but I have never seen people who don't go without any protection into farms. So I think we are aware of that. What I am a bit, this is probably a controversial topic, but what I'm a bit skeptic about is rescuing dogs from other parts of the world and bringing them into another part of the world where diseases might be more present. So I know there are a lot of different opinions on that, but that's something that I'm a bit skeptical about. Not meaning that we shouldn't do it. It's just we have to like stay cautious. Yeah.
Okay. You already answered a bit to the question that I would like to ask, but there is some aspect that I would like to go deeper. And from the point of view of an investigator that goes inside farms, because we have a protocol for especially avian flu, and there is a shitload of things that we have to do before going into a farm, and it's quite annoying actually, but it's needed. So there are some kinds of farm that you can consider less dangerous than others, regarding the type of animals that are breeded, or the type of farm. For example, the cow farms usually are open on the sides, so on.
I think chicken farms would be a type of farm, if you want to call it like that, who might have more risk, just because, as I gave in my example, the organism of a chicken is more like the organism of a wild bird than the organism of a cow to a wild bird. So I think the barrier for the virus to adapt to the chicken is lower than to adapt to a cow. But I would not this is just a speculation. I wouldn't promise this. But this is just something that I would speculate. Yeah.
We probably have time for one more question, if anyone has one.
Yeah.
Thank you for the presentation. You said that we have to keep an eye on the epidemic outbreaks, and my question is, do you have an alternative instead of killing the animals when there is, for example, an avian flu outbreak in a specific farm? Then all the animals are killed, like gassed. Do you have an alternative for that?
I think the best thing to do in that case is to prevent it happening in the first place. I don't know if to be honest, I don't know if there's an alternative to that, because viruses spread so quickly. I think the alternative would probably be to investigate each animal and see if they are actually infected, just in order to decrease the number of animals that need to be killed. But that's not practical. I don't think that if you would suggest that to anyone, they would say I think it's just not practicable, which is not an argument for us. Of course, we would still do it, but the people who are in charge of that, they would probably not do it. So I think the best alternative is to prevent it happening in the first place.
Okay, and I think we're out of time, so another round of applause.
Thank you.